I'm Spencer Ellis. I'm a consultant physician and rheumatologist, and during the COVID period we all had to redeploy to cover the medical wards and the COVID wards, which was a very challenging environment for us to work in. So we had to come up with solutions for minimising contact of the clinical staff on ward rounds with patients who were presumed to have COVID. Now that partly meant that we built new areas and bays that were isolated from the nursing stations and medical stations. But what it also meant was that when we went into a bay, we didn't want to keep coming back out to then go back through the next patient's notes and so on and so forth, as you might do on a normal ward round. And the other thing that we didn't want to do, which is part of the normal ward round activity, is to take lots of people with us. So it was primarily consultants or senior doctors who went in. The solution came by using mobile computers in those bays that had been allocated as COVID areas, and that meant we could go through the notes and the records beforehand, write something in those notes, and then one person could go in the bay and examine a series of patients but still communicate with the doctors who were left outside of the bay and not in contact with potential COVID infected individuals. That meant that the ward rounds could work much more effectively. You didn't have to try and remember all of the information about a whole series of patients, and we were minimising the movement in and out of the bay and the clinical contact with both staff and also the contact of patients with doctors too, who had been exposed perhaps in other areas to COVID. It was a really good solution and it worked very well for that period of time. The IT was pretty effective. Doctors could wear headphones outside of the bay, and similarly you could communicate in a very clear fashion. It also meant just a little bit of teaching could still carry on because you had a little bit of visual contact with what was going on for doctors outside of the bay, led by the consultant. So it was a very effective, helpful solution. It was a good bit of collaborative working, and hopefully such collaborations will continue in that sort of wake of COVID, where we're still trying to find how we're going to carry on our clinical activities in a sort of slightly changed world.